Hello guys, coming to our next upcoming IV induction agent is Etomidate. To read about Propofol, Thiopentone and Ketamine, you can always go through my previous videos. Coming to physiochemical structure, it is imidazole derivative, carboxylated imidazole derivative, which is Etomidate hydrochloride, and very important part is 99% is unionized at physiological pH. This imidazole nucleus makes this drug water soluble at acidic pH and lipid soluble at our physiological pH. So it is lipid soluble at physiological pH and water soluble at acidic pH. Also another important part is it has a content to increase its solubility, propylene glycol 35%, which is venous irritant. It had a pH of 6.9 and was venous irritant. To decrease this venous irritation, fat emulsion is used as a base. Coming to is pharmacokinetics. The initial distribution and redistribution time are 2.7 minutes and 29 minutes with T half of 2.9 to 5.3 hours. Clearance is by liver, very important. Can you tell me other IV agent inductions which are cleared by liver? Clearance is by liver by ester hydrolysis. So basically what happens is metabolism of etomidate is by hydrolysis of ethyl ester side chain. As you can see this diagram, it has an ethyl ester side chain to carboxylic acid by plasma esterase. Okay, this is converted to carboxylic acid by plasma esterase. It is suitable for single dose, for multiple doses, and in continuous infusions. Can you tell me the name of the drug which is not suitable for infusions and why so? You can go through my previous videos for that. It is suitable for multiple infusions. Why so? Because it has a so short elimination half-life, it has rapid clearance, and also context sensitive half-life, that is time period after stopping the infusion at which 50% of the concentration is left in the plasma, that is the context sensitive half-life, is even shorter than propofol, so it can be used for infusions. Coming to protein bound, it is highly protein bound 75% and has a large volume of distribution. Next, coming to mechanism of action, it is a single isomer, which is a unique feature of etomidate. Can you remember ketamine? In our previous videos, we discussed that it is a racemic mixture of R and S ketamine. So this is different from ketamine. It is R1 isomer, which is selective GABA receptor modulator. Can you tell me one IV agent which is not GABA mediated? Yes, ketamine. Ketamine was NMDA receptor mediated. It is stereoselective and antagonism of steroid-induced psychosis. Coming to pharmacodynamics and its effect on central nervous system, it acts on GABA A receptors. Name 3 IV induction agents which act on GABA receptor. Yes, first is propofol, second is thiopentone, third is etomidate. And another IV induction agent is ketamine, which acts on NMDA receptors. Coming to its effect on cerebral blood flow, it decreases the cerebral blood flow and decreases the CMRO2, hence it decreases the intracranial pressure also. Name one IV agent which increases the cerebral blood flow. Yes, ketamine increases the cerebral blood flow. There is no change in the mean arterial pressure. It does not have any analgesic property. So you always need an analgesic agent during induction with etomidate. You may activate seizure foci. So you can remember as etomidate for E and epilepsy for E. They basically activate the seizure foci. What was ketamine doing? Can you tell me about ketamine during epilepsy procedure? And also methotrexate, what was it doing? You have to go through my previous videos for that. They may activate seizure foci in patients with epilepsy, used for mapping of foci in neuroablative surgeries. Myoclonus is also among common problems of etomidate. Very important. It causes myoclonus like issues, as you must have seen with methotrexate. Okay, excitatory symptoms which was causing. Coming to induction, induction is heralded by loss of eyelash reflex. Can you tell me propofol induction was heralded by? Yes, it was heralded by verbal response. So apart from propofol, etomidate, ketamine, thiopentone, induction is heralded by loss of eyelash reflex. Coming to its latency and amplitude during auditory evoked potential, it decreases the latency and amplitude. Coming to its effect on respiratory system, its effect on ventilation is minimum. It decreases the tidal volume and there is a brief period of apnea might be seen during that, and you might observe hiccups or coughing. Some parts should be known by heart for every IV agent. For example, for ketamine, we have to remember that it was acting on NMDA receptor, it was causing increase in the blood pressure and heart rate, it was increasing ICP. Same for etomidate, we should always remember that it is the most cardiostable IV induction agent, causing minimum changes in the heart rate and BP, and there is no sympathetic activity also occurring. Therefore, myocardial oxygen demand to supply ratio remains unchanged. Very, very important for etomidate. And another important part for etomidate is its effect on endocrine system. So basically, as you can see, this is the pathway for formation of cortisol and aldosterone. So what etomidate is doing is, it is inhibiting this 11 beta hydroxylase. You should remember the enzyme's name also. It is inhibiting this 11 beta hydroxylase, hence decreasing the concentration of cortisol and aldosterone. So despite having very less context sensitive half life, it is not used for infusions. Only sole purpose for that is it causes adrenal suppression. So it causes dose dependent reversible inhibition. It is reversible inhibition of enzyme 11 beta hydroxylase, causing decrease in the production of mineralocorticoid and cortisol. Etomidate concentrations associated with adrenal cortical suppression are less than 10 nanogram per ml, which is much lower than the concentration needed for hypnosis. That's why it is not used in multiple doses, or it is not used during infusions. Increased mortality is seen on long-term infusions because of this, and this effect can last up to 8 hours after single dose and can go till 72 hours. There's a study named Cortico study, that is corticosteroid study after septic shock, which showed that there was no benefit of giving low-dose corticosteroid therapy in these patients. So basically, that is the conclusion, that it cannot be used for infusions because this causes adrenal suppression. Very important part of the etomidate. Second, coming to doses, induction doses at 0.2 to 0.6 milligram per kg IVs. This table has been taken from others. And sedation and anesthesia, limited to brief periods of sedation, can cause inhibition of corticosteroid synthesis. So that's why they are not used in infusions. Another route is transmucosal delivery, which bypasses the hepatic metabolism. I asked one question in Ketamine series, that why oral dose was much less than the IM dose. This is the reason for that also. You can go through my previous videos. Coming to uses, induction of general anesthesia is 0.2 to 0.6 milligram per kg. Sedation and anesthesia, it can be used, but not in infusions. In cardio unstable patients, very important, because myocardial oxygen demand to supply ratio is very well maintained. And in case patient has hypercortisolemia, we know that etomidate causes adrenocortical suppression. So hypercortisolemia patient will get benefit from it. Coming to side effects, this is the only IV agent which causes post-op nausea, vomiting, much more than others. Pain on injection because it has fat emulsion. Then myoclonic movement, very important. It acts on the thalamocortical tract, and incidence is as high as 50 to 80%. It can cause hiccups, and very important other part is corticosteroid synthesis suppression. Can you tell me the name of enzyme? Yes, 11 beta hydroxylase. So it causes corticosteroid synthesis suppression. So it should be used cautiously in septic patients, in hemorrhagic patients who require intact cortical response. And it causes increase in the seizure threshold. Can you name few novel derivatives of etomidate? Thank you. I hope you liked this video, and stay tuned for another IV agent. Thank you.